to make that comment again. You saw our diversity on YouTube. What did you think?
I'm very impressed. I've always been a fan of diversity. From diversity comes strength. You don't have strength as a group unless all your constituencies are represented. And I had a long administrative career at San Jose Medical Center in addition to practice. I was running a bunch of committees. I was chief of staff and this, that, and the other kind of thing. And I was always a champion of diversity. I helped diversify any number of meetings and boards and this, that, and the other kind of thing I was associated with, including the charitable and philanthropic stuff I was associated with. That's how I got that Civil Rights Award that I sent you a copy of a while back. Because I had a lot of time off at work. I had to be there all day long, but I had hours off. So I figured I might as well raise hell and do something good. So that's what I did.
Always do something good. When you're raising hell, that's not a bad thing. Everybody, we're going to get started here. I want to show you a news report that was aired this morning, an analysis of what we've been seeing over the weekend. Certainly since the last time I saw this class on Thursday, the president has been diagnosed with COVID-19. He went to the hospital. He certainly did a little drive around on Sunday, which was kind of strange. And then he came back in a flurry yesterday to the White House. But he does have COVID-19. He is considered infectious. So doctor, if you'll allow me just a minute, I'd like the class to take a look at this discussion on CBS this morning. And then I'm going to ask you, doctor, what are your thoughts? Is the media making a big deal or about nothing? Or should people be worried about this disease at the White House? We're going to get to that in just a moment. But let me go ahead and screen share. Bring back my videos and watch this story.
Welcome back to CBS This Morning. President Trump is back in that building, the White House, recovering from the coronavirus. But there are still so many questions about his health and the message that he's now sending to the country. The president, as you saw, removed his mask after his return for a photo op on the White House balcony. He went into the White House and came back out and took off the mask. And before leaving, Walter Reed, he tweeted this: "Don't be afraid of COVID. Don't let it dominate your life." CBS News senior political analyst and 60 Minutes correspondent, that's John Dickerson, joins us to discuss. John, it's always good to see you, but really, really excited to see you today. I think you can add a lot to this conversation, because I'm thinking the 200,000 plus people who have died from this and their grieving families may beg to differ with the position that the president is taking. So what message is he sending to the public today?
Well, the message, first to look at his return to the White House, the message he's trying to send is that he is strong, that he's defiant, that he has beaten this thing. And some people might take it that way. But 70% or more of the country, according to an ABC poll, say that the president contributed to his own condition, that he didn't take the coronavirus seriously. And they are likely to see this as a problem of his own making, because he downplayed the threat. He didn't wear a mask. He didn't follow the basic rules of his own administration. And so if he is responsible for his own condition, then he can hardly be triumphant in return from something he created. You don't get points for standing if you shot yourself in the foot.
Yeah, and you know what? The latest poll, two-thirds, that's a good analogy, two-thirds of Americans think that he's acting irresponsibly with his messaging. Do you think the White House will reconsider their strategy here, or no? No way.
Well, I don't think there's any reconsidering, because the strategy is coming from the patient. So I think that the question of whether the president behaved responsibly, if you look at the three main criticisms of the administration and the president's response to COVID as a national crisis, it's been basically that the president has downplayed the threat, that he hasn't put force behind the mitigation efforts and the protection efforts, and then that he has misled the country with respect to how bad things are. Those are the global criticisms of the administration. Those exact criticisms are being echoed precisely in the handling of the president's own case. And so since the majority of the country thinks the president mishandled the global situation, the mishandling of his own case that people think that he is engaged in only echoes the larger problem for him, a problem that the whole nation is still going through.
There's a danger in this strategy of declaring victory, too, isn't there, John, in that if he has a relapse in the next week or so, which doctors say can be a real possibility with the coronavirus, that he might have to go back to the hospital.
That's right. So that's a personal danger for the president. It's also when he says don't fear COVID and makes it look as though he's defeated it. One, it tramples on the feeling of the more than 207,000 families in America who've lost loved ones. Secondly, it exacerbates one of the things we know is at the heart of this story, which is that if you have money, means, and power, you can get treated. Or maybe you won't get COVID in the first place, but you're going to be better off than anybody in America who doesn't have the money, means, and power. So it exacerbates that issue. And this is still an ongoing story. And the president is basically saying, everybody get back into the game. You know, don't worry about this. Well, people are making their own risk assessments about how they can inch back into normal life. They're not going to be cajoled into that. We've seen that over the months of this virus. So they may very well look at the president, and instead of hearing his message of get back into the game, they may think, wow, if the White House could become a super spreader location, the most protected place in America, maybe this virus is even more virulent than I thought, and I should be even more cautious.
John, you mentioned money, means, and power. Many of the president's supporters don't have money, means, and power, and yet they support him because he fights on their behalf, in their view. When he goes back on the campaign trail, I have no crystal ball, but I'm guessing he's going to go as soon as possible and maybe even against expert advice. When he goes back on the campaign trail and he meets with those supporters, how is his message, his posture going to resonate with them?
Well, I think we saw from the supporters who went to Walter Reed and who he felt such a connection with that he endangered the health of his Secret Service by going on that ride to wave to them. The connection between the president and his supporters is quite strong. We've known that forever. The question, though, larger question is whether if he goes back out on the campaign trail, it surfaces all these questions that are at the heart of this, which is whether he is doing things for his own personal political benefit, his own standing, that are not in the public interest. That's been a question throughout his administration. It's a question here with respect to his personal health. And when he goes out there, if he's not following the health guidelines of his own administration, then it reanimates all of these questions that are at the heart of his own personal sickness. And by the way, there are 30 plus other people who were infected at this super spreader event. I haven't seen any statement, certainly from the president or anybody else, expressing sympathy or care for those people who are going through a version of what he went through. Public campaign events raise all of those questions again and keep this center stage, which is an issue he doesn't want at the center of his reelection campaign.
Yeah, and as we pointed out, John, no evidence of contact tracing by the White House yet at all. Thank you, John Dickerson. We appreciate it.
Cyclops of the KKK, Robert Beard, who he's called a friend and a mentor. So when you compare that record of Joe Biden's 47 years of either just ignoring black voters or
Bob, you are still muted.
You're on mute.
I'm back. I'm sorry. I got my voice back. Sorry about that. You see, Doc, even I'm still getting used to this. That's the best synopsis I could find this morning. As I said earlier, the Fox News Channel website is promoting this as, or at least showcasing this as a triumphant return. He's in charge. He's on top of it. Well, after our discussion last Thursday as a class, where I promised to bring in a doctor, I thought we'd be talking about the concerns for young adults and partying and all those issues that we will get to. But Dr. Hencke, thank you for joining us today. After hearing that synopsis, after seeing what unfolded in the White House and with the president, what are your overall thoughts about the virus and the dangers?
Well, this whole episode regarding Trump is just absolutely astonishing. I mean, we know it's a dangerous virus. Theoretically, we should have known about it at the end of December, because Taiwan knew about it at the end of December. We had our guard down. That's a very, very long story. But we saw all kinds of elementary rules regarding how to handle an infectious disease being violated. This little jaunt of going out in that car with Secret Service agents, that car is sealed. It's airtight. This thing is primarily transmitted by air. Now, a mask reduces your risk, but it doesn't totally eliminate it. If you have a mask on, but you're still stuck into a small space with a COVID positive individual, and early in the course of the illness, they have a high viral load. They're breathing out a lot of particles. You're still at risk. All you're doing is mitigating it. They would have had to have one of those Ebola suits like I practiced wearing during Ebola time. You know, it makes you look like a giant condom and you're covered from head to toe. That's how they would have had to be protected rather than a simple mask. That was absurd. There's all kinds of reasons why this was wrong. The heavy-duty regimen that Trump was on indicates he probably had a relatively severe case of COVID pneumonia, or he was being overtreated. Now, it's arguable that he could have been overtreated, and they would have argued that he's the most important person in the United States. So if anyone gets, all guns blazing treatment, it would be him. However, that carries a risk. None of these medications are without side effects. Decadron in particular, which is a very widely used medication for years, can make you floridly psychotic. And I have seen that more than once. So, it's risky. You don't usually get that unless the patient has a severe COVID pneumonia. There is evidence he had the pneumonia. They won't reveal his chest x-ray findings, which is highly suspicious. But we don't know really now whether he has a light case that's been overtreated or a moderate case that's been vigorously treated semi-appropriately. No ordinary patient would have been released to go home this early in their course. He's still at risk of a relapse. He might breeze through, in which case he'll do what the president of Brazil did and boast about how macho he is and what a studly leader he is. Now we should all be exuberant.
Last night when I was looking at social media, on Facebook, there was a picture and a little accounting of what happened to a fan, a supporter of President Trump, the African-American business leader, Herman Cain. He went to the Tulsa rally with Mr. Trump during the summer. A few weeks later, he had to be hospitalized with COVID-19 because he wasn't wearing a mask, he was close to the president, etc. And 29 days later, he died. We are now exactly 29 days away from the election. So
this was an avoidable death. This is an avoidable death. We know epidemiologically how to control this. In 1918, everybody wore a mask during the Spanish flu epidemic. It was not a political issue. There is a choice been made to politicize this so that you're a wimp, you're not macho, or you're whatever, you're knuckling under big government or some crazy stuff if you wear a mask. It is not political. It should not be political. So it became a political test within the coterie of people at the White House to not wear a mask whenever possible as a sign of loyalty to the president. So he basically is the most pro-COVID force we're dealing with in the United States. He's done seemingly everything within his power to spread the disease rather than to mitigate it, not the least by showing a lousy example to the rest of us, instead of trying to lead by example, like most leaders would do.
Now, I'm going to speak on behalf of the conservative point of view and say, aren't you being a little biased there, doctor? Isn't this really just something that he's proven he can do?
Well, I'm not politically as left as you might think I am, Bob, so I'm not looking at it through a political lens now at any rate, because I don't know what's conservative about not conserving your health. Yeah, you just need to follow the science, because there's overwhelming evidence that masks protect. I mean, they've done these studies, like if you're in a small cubicle with another person who's COVID positive, you aren't, and you're talking and chatting for 15 minutes, you come out of there more than likely to get it. If one of you has a mask, you're maybe a quarter as much likely to get it. If you both have masks, the risk is not zero, but it's maybe down to a 20th of what it would have been otherwise. So these simple measures, we don't even know if a vaccine will be reliable, have to be followed if we want to mitigate the spread of the virus. And of course, the common conception is it's worse on old folks. Well, it is, but it's so idiosyncratic. You don't know really who it's going to affect the worst. We've got 103-year-olds discharged from the hospital in fine shape after getting COVID. They've gone into these nursing homes when it started spreading in nursing homes in Washington State and found maybe 40% of the people there were asymptomatic carriers. And none of these people in nursing homes are healthy. So it's a lot more than just age. I think I sent you an article last week of the 17-year-old athlete who there's nothing wrong with him. He didn't smoke, drink, do drugs, have diabetes, anything. And he got the late inflammatory phase anyway, and he died after a couple months struggling. So even if you're young, you never know if your number is going to come up, because we do not know the genetic correlates which cause people to be susceptible to this disease. We're only starting to get definition of that aspect.
Thank you, doctor. I'm going to open it up to the class in just one more moment. But first, I wanted to give the doctor a chance to communicate like we did. Doctor, you said you had a chance to hear their stories, their cultural identity. I noticed in the interview, you and I talked a little bit about it very briefly. Could you tell us again your background? You're obviously a white American, certainly an elder American. You're retired. What more can you tell us?
Well, heterosexual. Ethnically, I'm the son of immigrants and hillbillies. And I didn't know that being a hillbilly was a bad thing until I saw Beverly Hillbillies. When I was 12, I asked my mama, what are we? I told you this story, Bob. And she said, we're human beings. What do you mean? And I said, no, mama. The people across the street are English, from England. The people up the street are Cajun. People behind the back fence are Italian, and the Negroes live on the west side. What are we? She said, well, your dad's half German, half Irish. And folks were immigrated over to this country and said, my people, what would you call hillbillies? Mama, what's hillbilly? She said, you remember when we went to Virginia? I was 12. When you were 9, you know, these folks don't have running water. You go to an outhouse and drink water out of a bucket with a ladle. This is my family. How she worked herself out of dire poverty and got a degree in science when women weren't supposed to study science is a whole nother story. My mom was a tough woman, but she was not ashamed of being a hillbilly. So I'm a Texas redneck. I've just been anti-racist since I was a small child because that's how I was brought up.
And then my last question before we give it to the students is, you told us in our interview about 3 incidents of racism in the medical profession. As far as you can tell today, is that still going on in the South? Is that still going on across the United States?
I would hope it would not be going on to the extent I saw it, where people got major operations that changed their life forever with no clinical justification, or were sexually assaulted during their female examinations. But I bet the latter still goes on in some of these nasty areas. Those attitudes were terrible. There was a case I just read of recently. It's a Black woman in Chicago or someplace like that. She goes to the ER. She says, I got a high fever. I'm afraid I got COVID. I forget which of the many media sources I read this in. So the nurse says, you don't have a fever, go home. And she saw a doctor of color. I don't know if that meant African-American or any other deeply pigmented person she thought might be sympathetic. Said, hey, doc, help me out. Made the nurse actually take the temperature. It was 101. She was sick. This stuff still goes on. People in some areas who are brought up with this racial baggage automatically assume the worst about other people based on physical characteristics which have nothing to do with their clinical situation. So some of this does still go on.
Sorry to hear that. Lester, why don't you get us started?
Ooh, okay. Usually I develop my questions throughout the conversation, but I mean...
That's all right. You get to go first. Go.
I watch a lot of sports, mostly basketball. And I was wondering if you think, like, in our case, California, do you think we'd be able to implement something such as, like, the bubble?
I think the bubble looks very promising. I'm a sports fan, and it looks like the bubble's working for the NBA, and so far the bubble's working for the baseball playoffs. So, I mean, life goes on. We don't want to die for sports, but once we can work out a protocol, and I mean, there are scientific protocols which allow us to return to activity, but first people have to accept we got to control the virus, which hasn't been accepted. But yeah, I think there's a way of doing a bubble thing to get sports to return. The rigorousness of the protocol and how well they're followed is critical, and we can see that with problems like with the Tennessee Titans and the Marlins earlier in the truncated baseball season. But I think it's a really good point. You're muted, Bob.
I'm just going to leave me on and try to be quiet. Tiana, I called on. Tiana, are you there? All right, then let's move to John Maxwell.
So my question pertains more towards like the COVID-19, like in general. So obviously we do have our safety protocols in place where our social distancing standards, you got to stand 6 feet apart, wear your mask, don't really like touch, like try not to like touch other people and just keep to yourself. But how effective would it be for a person who, let's say, probably has to go out, like outside, like out of their home into like the stores around like people in close contact? how efficient are these standards for that person in like a grocery store environment per se?
That's a good question. And I think one of the main points is it's all cumulative risk. I don't think any of us can live our lives without breathing a few viral particles somewhere along the way. You got to get yourself fed, but you want them to be as few as possible and spread out. So I think shopping when things aren't crowded, maintaining your distance is very, very important. We made a mistake the other day of sleeping in and going to the grocery store around 11 o'clock. I was getting claustrophobic. I knew there had to be someone in there with COVID. It was so doggone crowded. I think if you're out in open air, I don't see anybody within 10 or 12 feet of me and there's a breeze and I'm out in the open, I don't think there's a necessity for a mask. If I go hiking, I'm not gonna wear a mask unless there's a whole gaggle of people I can't get through. But if you have a crowd that's all sitting around together, kind of packed, even if they're in open air, you can see how viral particles could still accumulate at a relatively large level in that crowd. So something like that Sturgis motorcycle rally with all those people packed together turned into be an event that spread COVID. You don't want to be packed together indoors or outdoors, but indoors is far, far worse. It's mainly a function of circulating air diluting the viral particles. So as we go into the cold seasons, the science of indoor ventilation, the whole HVAC thing has to be completely rethought. If you look at the epidemiological maps out of Wuhan that came out when this thing first broke loose, you saw that people who were seated far away from the source of the infection still got infected. This is aerosol transmission. Droplets don't get that far. The CDC is only now recognizing this when it was obvious from the epidemiological maps we saw in March. What's the delay? I don't know. This thing's being politicized, but be that as it may, you want to minimize the viral particles you're exposed to, avoiding large crowds, especially indoors, avoiding packed together clots of people. I don't like wearing a mask. I like to be outside where I don't have to wear one if I'm not around other people, but I'll be damned if I want to get the disease.
That brings me to Manny. Manny, I think you were the one that brought up the concern about the media going after young adults. You want to follow up on that?
I understand the concern over college students going back and partying, but I also am concerned about people of an older demographic who may be Trump supporters and are not wearing masks because they don't believe the science behind the transmission of COVID-19. So I'm wondering which demographic is the most likely to spread COVID-19 and what can be done to convince each demographic to mask up and stop the transmission of the virus?
It's a great question. If you just look epidemiologically at the numbers, young people are at the greatest risk because their lifestyle is different. They're out there doing things, living their life, learning a lot of new things and meeting a lot of new people. And I remember that phase of my life with joy. I don't get around as much these days. However, if you're in a situation where you're a college student and you got support staff around you who's not masking up, let me tell you, you are at risk, and that's an outrageous situation. It should not occur. The same rules should go for everybody. It's these so-called essential workers. And having had 4 janitorial jobs to put myself through school, they get a lot of my sympathy. These people are at great risk, and a lot of them are more risk than us because they go home to crowded households, sometimes multi-generational households, sometimes with only one bathroom in the damn house. So those people are severely at risk, and there's absolutely no excuse for support staff in a place where students have to gather and study to not be obeying the guidelines. I hope I answered your question.
Yes, I do have a couple of follow-up questions later.
Sure.
All right, we'll try to get back to that as quickly as we can. Madison and then Candace.
My question was regarding prisons. They've been having lots of outbreaks and stuff, and I just want to know, like, what do you recommend that they should be doing? Because I have family in there who's at risk, and it's ugly in there. They're not getting their court dates. They're not letting people out. They're overcrowding it. So what do you suggest?
That's a real hard question. They are already trying to release a lot of folks they think they can get away with releasing. And I think you have to do that But what you do with the folks you don't think you can release, I don't know how much space they got to space them out. Those people are at terrible risk. And if you look at the COVID map on a daily basis, you look at Lassen County stuck way up there in the Northeast. Why do they have such a high COVID rate? Well, there's a prison there. I mean, the guidelines for those folks theoretically are the same as for the rest of us. Separate and mask up. But how the heck you can do it? And I do know that a lot of the people that work there end up being COVID positive. So it's a big problem. I do not know what resources are available to solve it. All I can do is acknowledge it.
Candace?
So my question is less COVID-19 related and more about medical racism. So as an African-American woman, like I've been really concerned with seeing like the amount of Black women who have lost their lives specifically during childbirth. And I know a lot of people who are pursuing like a degree in medicine so they can be, you know, kind of like a face and provide the proper support. So I was just wondering, even though I'm not planning on having kids for probably like another decade, I was just wondering, with your medical expertise, is there more advantage into like at-home childbirth versus being in a medical and than being in a hospital if you were Black?
Good question, and I can certainly understand where you're coming from. All 4 of my kids were born at home, by the way. But I mean, I acknowledge that African-American folks get a short shrift, not in every case, but by and large. Studies have been shown that your average practitioner has less perception of the pain of a Black patient than that of a white patient. You know, and if you got a different pigment, you're probably somewhere in between, but there's a lot of bias in how things are perceived. So I think part of it is to be an aware consumer, interview the people that are going to take care of you, talk to some people that have been at the facility, see if you get any drift that these people might have an attitude where you would not be treated with as much respect and love and support as anybody else. That is a very real problem. You know, and if I could prescribe anything for this whole damn country, I would prescribe Lerone Bennett's writings on Reconstruction, which were written in Ebony Magazine, 1965, circa. That became my Black history course. When you really, I was very curious about these people I wasn't allowed to be around except when they were in a servile position. So they had no Black history way back when, so I invented my own course. If you study about the struggles of people and realize how much they've been shafted, Americans root for the underdog. You start rooting for these people. So I went to college rooting for the Black people to succeed. You were never allowed to see an articulate Black person on television, you know, because they wanted to pretend that they couldn't think. You know, you got to be an informed consumer. I mean, in general, home births are more risky than hospital births. If it's a young, healthy person, they got the right support. What can I say? I got 4 healthy kids. Maybe I'm lucky. But that's about the only comment I can make. Be an informed consumer, because this stuff isn't being eliminated overnight. We need a massive educational program. I don't see that happening. But if I had my druthers, there'd be a Truth and Reconciliation Commission like Nelson Mandela had, and everybody would read Lerone Bennett's writing. That man was not a Black racist. He believed in true equality. When he capitalized the word Black in his writing, he also capitalized the word white. But you get an idea when you read what he wrote, how close we came to having real chance of racial equality in the Reconstruction period, and how that was sold out. 1 vote. Andrew Johnson failed of being convicted when he was impeached. That turned a whole lot of things. And by the time Rutherford B. Hayes was in office, the Reconstruction was being routed. You know, in Louisiana in 1870, there's 1.7 million Black voters. Then the terror started, the Knights of the White Camellia, burning houses, lynching people, trying to reassert the control of the Bourbon aristocracy. By 1880, 10 years later, there's 170,000 Black voters in Louisiana. That's what happened. Nobody knows about it. That's the kind of mentality that gave rise to the Tulsa Massacre. You know, I know all kind of white people say, I'm not a racist, but this is a bunch of bullshit. You know, they got equal opportunity. They don't know about this stuff. They don't know what went on. There has to be education to change people's minds, change people's perception. Anyway, you got me on my soapbox, but that's how I feel about that.
All right. Thank you, Doctor, for your candor. Jesus.
Yeah, hi. I wanted to ask about a recent thing that's happening right now in SJSU athletics. Recently, the football program moved 135 people to Humboldt State in order to conduct player contact, practices, because Santa Clara County doesn't really allow that right now. So they're just trying to avoid that. My question is that, well, let me just set it up a little more. There is an announcement by the football program that they were only testing players, coaches, and staff once a week, right? But Mountain West Conference announced that, or requires everyone to be tested 3 times a week. So my question to you is, what's the right number of times for that many people to be tested for that type of move to happen?
Good answer. I mean, good question, but there's not a clean answer. Okay, so it has to do with a lot of other things. What's the support situation around there? How many other people are involved in supporting the team and their practices? Where is the lodging? What is it like? Who are those people? Are they being tested? So it has a lot to do with the environment in which this whole thing is being ensconced. And so I don't think there's any magic about testing. And this thing that just happened with Trump illustrates that. Hope Hicks tests negative. She gets on the airplane. They do this event. On the return trip, she starts feeling a little ill. Hell, it's the same day. They test her, now she's positive. There's a lag time of a couple of days. Depends on the individual. Where you're a carrier, but you've got infected, but you don't know it yet because you've not gotten sick. And some people never do. But during this period of time, you're spewing lots of viruses. So there's no clean answer to that question. Okay, even testing every day does not give you an absolute guarantee. It's all a matter of cumulative risk. So, and it's also a matter of affordability. Where are they going to get the tests? How much they have to pay for them? What's in the budget? So all these things have to come into play. I understand why they went up there. They wanted to practice. Myself, I got to back up Sarah Cody. I think she saved a lot of lives. Some people think, our county health officer in Santa Clara, some people think she's too hardcore. She's got national recognition for that. She's also gotten death threats. However, I'd much rather have her in charge than a lot of the other people I see around the country who are pretty loose about the matter. So there's no absolute answer to that question. I hope I've given you an approximate answer, though.
Yeah, no, that works. Thank you.
And while you're talking about sports, Doctor, real quickly, the National Football League is now in progress. You got the playoffs in baseball. You got basketball. Do you really think we're going to see any issues in the professional sports world before this is all over? Because we're already seeing some teams, but now they're letting fans come into stadiums to watch football games.
Well, as we almost undoubtedly will. We have a federal system. We're not in lockstep, okay? Some people are going to do things different than other people will. And so it's a question of also, how do you pack them in? I was at my favorite sushi restaurant the other night. We got partial opening here in Santa Cruz County, okay? Let's pick up takeout. So they can have a certain amount of tables. Well, what do? Do they spread them out for social distancing? There was 3 tables in this little, relatively airless corner, all packed together. I mean, that may meet criteria, but it doesn't meet my criteria. I'm not going to do that. So
I've just never thought it was logical to expect millionaire players of any sport to stay in a hotel room and not party and not go out and not have sex, not do anything that they normally would do, because over time they're going to get frustrated just like the rest of society.
But it's amazing how few people broke protocol, or let's see, and actually got caught, right? Maybe some did, they didn't get COVID. But you have that situation in the Cleveland Indians where these 2 pitchers, Clevenger and that other guy, went and partied hardy, and then I don't think they got the disease, but they got busted for violating protocol. They shipped Clevenger to the Padres where he blew out his elbow. I won't editorialize about that, but yeah, it's very tough. It's very tough. But LeBron James is doing it.
Yeah, he's surviving very well.
Yeah.
Megan, why don't we go to you next, and then we will talk to Polina. Megan first.
I guess it's not really a question. It's more or less, what would you say? So my mother, she's very anti-mask. She thinks they're unnecessary. She thinks it's stupid, quite frankly, and she doesn't understand why anybody wears them. What would you say to her? Because I've had so many conversations with her, explaining to her, like, you are at risk, your age group is, really at risk. I've talked to her about science. I've tried to give her so many different reasons why she should wear a mask, and nothing really gets through to her. Is there anything you think that I could possibly say that would, get through to her?
Well, that's a tough question. I mean, I don't know anybody who's into that QAnon stuff, but they say you can't even talk to those people because it's kind of a religion with them. I don't know if she's really fully drank the Kool-Aid or if she's just stubborn. Some people these folks with these opinions generally aren't influenced by science or statistics or even facts. They may be influenced by anecdotal stuff that appeals to them on a personal basis. So if you find a few stories about folks like your mama who didn't believe this way and then they died of COVID, there's at least a couple of these Bible Belt preachers that were preaching, that COVID is a hoax and they're just trying to bring down or whatever, They died. There was that woman who spoke at the Democratic Convention, her dad, a Latina woman, her dad was a Trumper and he didn't believe in masks and he died. So maybe the only way to appeal to somebody like that would be through personal stories that they might be able to reflect. Could be me, because that's a really tough one. It's kind of like getting someone to change their religion.
It is. It's tough to convince people that you know and you love that their view is not the right one, but all you can do is keep giving them the information as best you can. And
what's her source of media? Does she have a variety of input, or does she just, choose things that reflect her own biases?
She loves Fox News.
That's a problem.
Yeah.
Well, see, you will never learn the facts if all you watch is Fox.
Yeah.
When we evacuated to a friend's house who's 83, and she's an extreme right-winger. Nonetheless, we've been friends for 45 years. We've argued politics for 45 years, still disagree. We had to watch Fox for 2 friggin' days. I mean, man, give me Jimmy Carter's hemorrhoids instead, right? But there's entire groups of facts that they never present. So you'll never know what the hell's going on if that's all you watch. Now, there was something called the Fairness Doctrine. It expired around 1987, I believe. The Fairness Doctrine required media to report both sides of the story. So if you're doing a Biden story, you've got to present Trump's side and vice versa. Due to various First Amendment conflicts and political whatever, the Fairness Doctrine got killed, okay? And right now, with the proliferation of social media, you didn't have this choice when I was a kid. You're gonna watch Walter Cronkite. You're gonna watch the same news as everybody else. We got the same set of facts. Then we can make different opinions about it. We're not even getting the same set of facts now. That is a problem your generation hopefully can tackle. My generation ain't gonna be around to solve it. But that is making this country sick. I've got friends back east, back down south, who are Trumpers, and you can't hardly talk to them because they live in a different world because they don't know what you know. You can always watch Fox and kind of see what they're being fed. You've got to persuade someone to have a different set of data input, or you're just going to be programmed. You won't know anything else. I don't know how to solve that problem. I'd like to have something like the Fairness Doctrine come back.
I would too. I'm all in favor of it. I think the media has made a lot of money by having biased, specialized style of reporting, and that's not necessarily serving the American public very well.
And the way Facebook and other media, other social networks select your biases, right?
Yeah.
Like if I look up dogs, I'm going to get a lot of stuff about dogs. Same thing if I log onto some right-wing site, I'm going to get a lot of right-wing stuff.
Paulina and then Brooks. Paulina.
Hello, doctor. I was deeply shocked and frustrated by these 3 stories that you shared. And when I made a little research and I found an article, the Guardian one, that says that African American people die in some areas seven rate in comparison to the white ones, and some like three times as many as white. Like it varies, and I try to find the reason. Can I say that it correlates to your story, so that people have trust issues, they're afraid of doctors, afraid of system as a whole, so that they don't go to the hospital when they feel sick? Or like, how can we explain such huge difference?
That is a really good question, and there's several factors into that. A couple big ones. One, disproportionate number of people in the important jobs we call essential jobs, right? And these are often more low-paying jobs, like the janitorial jobs. I had to put myself through school. We can't live without these people. We don't pay them much. And since they are often lower income workers, they live in more crowded situations, like I mentioned. Bunch of family members packed in there, so they're going to spread COVID a lot more. But another thing we haven't mentioned here, and y'all, I'm sure, are aware of it, is the fact of environmental racism. Historically, Black folks and other ethnic minorities have lived in less desirable areas. Why does this persist, even as the march towards economic equality persists? A lot of it's historic. My hometown of Port Arthur, Texas, has one north-south avenue, and the Black folks live on the west side, white folks live on the east side. Why is that? Because to the left of Woodrow Avenue was the malarial swamps. And way back when, Black people had no choice of where they're going to live. You want to live anywhere here, you want to live on the other side of Woodrow, okay? You get malaria, it's your tough luck, okay? That's where all the refineries are, most of them. You know, it's a cancer cluster. So where are the refineries? Most of them are on the west side. Who gets the pollution? The African-American folks. So this historic legacy is one of the reasons we have structural racism scattered throughout this country, because of where people are living, which has persisted even though we think we're all equal now. Well, you know, maybe people need to have less polluted neighborhoods to live in. Maybe they need less crowded circumstances. Maybe we need more housing, better housing. And we sure don't need to have one section of our population which gets a disproportionate share of all the pollution and all the crappy environmental factors. But that still persists. Native Americans, same deal, but in a different way. Latinos, you know, the list goes on and on. But obviously a lot of it revolves around the way Black folks live their lives. So yeah, they got a right to be suspicious. You know, you got a right to look over your shoulder. Doesn't mean any of this stuff's going to happen to you, but it just could. It's been going on for a long time, so, you know, it's a matter of being aware.
Brooks, and then Christian Moreno will be next. Brooks?
So even though this whole coronavirus thing, we all wish it was not a partisan issue, it seems obviously that it has been politicized in numerous ways. And I was wondering what your opinion is on all the protests, because it seems to me that a lot of people don't put blame on the protests for spreading the virus, when it seems to me that joining and walking with thousands of other people along one street would be a really, really great way to spread it. And I feel like a lot of people aren't talking about that. And I was wondering if you could weigh in on how much you think that has contributed to the spread of coronavirus, since that was really big over the summer and is still going on in some places. And I was wondering if you think that that spreads it more than proponents of the protests are willing to admit.
Brooks, that's a very good question. And you may have a really good point there. I have not seen epidemiological studies on how much infection there's been in Portland and other areas where they've had massive ongoing protests. I think that's a good thing to look at. I mean, I know we had some spread after Sturgis. It might not be as great as one political party would like to say. There was some spread. I don't know if it was massive, but anytime you have a lot of people clustered together, you have a risk of spreading COVID. It doesn't matter what they're clustered together for. The amount of ambient wind you have going through the area matters. How close people are together matters. The degree of, the duration of time where they are together matters. So there's absolutely no doubt when I saw that going on, I was worried that it could be spreading COVID. I haven't read much about it. And I think that any mass gathering, we should look at the consequences because we need to study the epidemiology. So you've got a real good point.
Very good. Thank you. Christian, and then Guadalupe.
So a lot of people after contracting the virus and then testing negative are still feeling the effects of the virus months later. So do you think these people are eventually going to recover, or is this a lifelong problem for them?
A really good question, Christian. These are the long haul patients. We don't know a lot about them yet. From anecdotal stories I've gotten from, well, in particular, I know a physician who's got infected. I think there's going to be different degrees of this. Clearly, there's some people that haven't gotten over it yet. They're having persistent symptoms, a lot of times brain fog, some musculoskeletal symptoms. And since we're still early in this, we don't know how long that persists. Now, my personal friend, a young, healthy Mexican-American physician in his 40s, working at the same hospital I retired from, hospitalist working on the floor, did catch COVID, never got tested, but he lost a sense of smell and taste. It's pretty obvious he had it. Went back to work, figured now I'll take care of the COVID patients on the floor because I don't have to worry about it. The other doctors don't have to worry. But when I chatted with him a couple months later, he had some long haul symptoms. He got the COVID toes 2 months after his initial infection, and he was getting the COVID tummy, the cramps and the diarrhea. Still been able to work, and said he's a relatively young, healthy guy. But this is a really good question. We don't know the answer to it yet. I suspect that there's going to be a spectrum of long haulers, some like my friend handling it okay, and maybe some having persistent disease. Too early to tell.
Thank you.
Very good. Ryan So, and then Jayla.
I guess my question is, if you were in Dr. Fauci's shoes, what would you do differently on approaching this whole situation? And if so, why would you do it that way?
That's a good question. When I think back on what Fauci's done since we became aware of this, there's two calls, one call initially on the masks. And as an emergency physician, I had to wear a mask. And the officials were all saying, well, don't use the mask. We're not sure we need them because we need to save them for the medical people. To me, that was counterintuitive. And I think that he went along with that because they were afraid we'd get hit so hard that all the mask supply would vanish. And indeed, they were really hard to find there for a while. But that really wasn't the correct advice. The other time Fauci got short was when he said we had an antibody test coming, and the reagent was bad. The chemical they need to put in there to make it react to see if he got a positive. There's no way he could have known that, but it kind of made him look bad. But I don't think we could have had a better person in charge. No one can be perfect. I think he's made pretty much all the right calls. I think he's gotten his legs cut off, or they've tried to any number of times. The reason we're not hearing from him so much anymore isn't that he's gone away. They're just not letting him speak. But I think he's the best guide we have. And overall, I applaud his performance.
Very good. Let's see. Ray, you're back with us. Come on and let's hear your question.
Well, my question was kind of answered through like several different people, but I kind of can reiterate it here. So I've come across an older generation of folks I'm staying with right now, and again, as you said, they need to obviously go through education and personal, I guess, stories to kind of convince them that COVID is a thing. But to some, I don't even think that they don't believe in the COVID as a disease. They think of it more as in hindering their freedoms, and the fact that the government is doing a ploy on you to kind of keep you inside and whatever it may be. But kind of going off of what Megan said, like, how would you, like, what's the best thing to say to a COVID denier when they just don't want to listen to any sort of facts?
Oh man, Just give me a nice handy redwood tree to bang my head on. You know, this is just an unrewarding exercise. A lot of people have drank the Kool-Aid. You can challenge them to try to get some different sources of information, but I've never seen anything so politicized in my life, and I've been around a long time. I don't think you can convince some of these people. Sometimes you just have to use brute force. Okay, sucker, you want on the airplane, put on a mask or get your butt off the airplane. You know, I mean, what else are you gonna do with people like that? You talk and you talk, and sometimes the more you talk, the more convinced they are in what they think. So I do not know how to beat sense into folks like this. You got to manage them. I don't think you can convince them.
Appreciate it.
I've been wondering about that too, especially on airlines and how they're going to be able to manage all of this. Jayla, did you get a chance to do your question?
No. My question has to do with what you talked earlier about medical and environmental racism. So Black people and people of color are more at risk for COVID, especially people of low income who don't have the same advantages as most people. And I was wondering, what do you suggest to these patients? Like, what did they, to ensure that they're being taken seriously and not taken advantage of during urgent care?
A lot of it might depend on what system you go into. Urgent cares are quite variable in the quality of care they offer. I've seen excellent and absolutely unacceptable care, both in urgent cares. I think if you have the ability to go to a university medical center, for instance, if you're in Santa Clara County, Valley Medical Center, okay, they're not going to be biased at Valley Medical Center. I was on staff there for a long, long time. Generally, your university and county facilities, at least in this area, are going to have a lot of people of color working there. They're going to be diverse and they're going to appreciate diversity. And they're going to be much less likely to react with bias than a person who says, I've never taken care of a person that looks like this before. You know, so that's my advice. Even though I saw a lot of horrible things at Parkland Hospital, right out here, if I'm a person of color, I don't have much money and I'm worried I'm not going to be taken seriously, I'd probably go to Valley.
Very interesting. Daniel, I see you're there.
Hey, doctor. So right now I'm currently in Afghanistan. The tests here are very, you can't really get the results as fast, but I do have a quick question for you. I do have the IgM and IgG antibody test with me, and we're testing currently our staff members. I was saying, the question is, I was gonna ask is, do you think that this IgG and IgM antibody test is just as effective as a nose swab? And moving forward, do you think that somebody who takes the antibody test can just be, I guess you could say, like, calm with the results when they get it, or do they still need to go through the whole process of getting the whole nose swab test done to be sure of COVID?
I'm going to have to disappoint you. These two tests test for different things. The antibody test tells you of prior infection. It takes a while to develop an antibody response. So you get the positive antibody test, you say, okay, that's why I was so damn sick a couple of weeks ago. I had COVID. But it's not going to help tell you if someone's acutely infected. It turns positive too late in the course to help you with that. So you're going to need a nose swab, a spit test, or some equivalent assay like a PCR, polymerase chain reaction, so you can identify the viral antigen, not the antibody that reacts to the viral particle. So you're hosed, frankly.
Daniel, did you have a follow-up? I thought it looked like you were going to ask something else.
That was pretty much it.
I hope I didn't give you a dismal answer, but really you don't have the right test, so there's no way you can tell the right thing from what you got.
That's just one of the tests we have so far.
Okay.
I know my brother just received a vaccine that they are going to test soon. I think they're just waiting for the authorization. But once when the vaccine comes out, we'll see if it works. And hopefully, I mean, here, testing wise, when I was on my way to the house, people are not wearing masks here. So they're just going about their daily lives here. So the risk of COVID is very high. They don't have the exact amount of information to know who has it, just like how they have in the US. The cases are just so high. So I've been staying inside. I haven't had any contact with the outside because I'm just scared of getting COVID because not everybody's wearing masks. They're not going with their protocols. And these antibody tests are just something that we have for now until we find the resources to test everybody within the company to make sure that they don't have COVID.
Well, it's not totally useless because you can probably assume that you have at least partial immunity if you've had it before. Trouble is we don't know how much immunity that confers and how long it lasts.
Very good. Thank you, Daniel. Stay safe. Let's go to Guadalupe and then Arana, then Ruth.
Thank you. Do you think that there could have, or what do you think would have been better protocols that could have been implemented as of right now, other than wearing the mask to avoid the spread of COVID?
Well, I mean, unfortunately, the wearing the mask in the right setting is the most important part of the protocol. I mean, barring that, you need to do the spatial distancing and space out people, especially inside. And there also needs to be a lot more attention paid by businesses and, you know, residential establishments to how their ventilation is arranged so that you get fresh air coming in and aren't recirculating the same old air, because that definitely skyrockets the COVID risk. But mask is the centerpiece of epidemiological control.
Okay.
There are many tools.
Ariana? I'm sorry, Guadalupe, did you have a follow-up?
I was just gonna say, because I know that in Tijuana, they were actually issuing tickets for the public that was out and not wearing masks. They were issuing people tickets for not wearing masks, and they were issuing tickets for the businesses and making sure that businesses were following protocols. I know that they even had, when you were walking into a store, not only did they check your temperature, they had hand sanitizer. They also had something for your shoes so that it was cleaning your shoes as you were walking in and walking out.
That's very good. I'm impressed. I think Tijuana sounds a lot safer than Texas right now.
That's saying a lot. Ariana, you're next.
Okay, I just wanted to make a note about Jayla and Candace's questions, because when I was born, my mother did C-section and my mother's Black, and they actually, when they were cutting me out, they actually cut me. And I think that that's part of that statistic that's going around, that they show less care for Black mothers giving birth, because there's a statistic that's they're 3 times as more likely to die. So I just wanted to point that out, that I think that my existence is proof that there's less caution when they're dealing with Black patients. But my question was, in terms of the whole vaccine, they're saying that it could be out by the end of the year, but do you think that that's too soon? Because I've been hearing that vaccines usually take 2 to 4 years to really be deemed useful, or that they actually work. So how do you feel about vaccines coming out sooner than normally? Do you think it'll really be effective?
It's not just a question of effectiveness, it's a question of side effects. When the swine flu epidemic happened in the 80s, before y'all were born, the professor, you'll remember that, they rushed a vaccine into production. People were dying, not near at this rate, but people were panicking. So they rushed this vaccine. Well, a lot of people got Guillain-Barré syndrome, otherwise known as Landry's ascending paralysis. Does that sound fun? Starts at the feet and it goes up until you're all paralyzed. Young people usually recover. People my age, not so lucky. So you get a bum vaccine out there and you're not sure you've trialed it properly. People get side effects. You got people in wheelchairs. There are people that can't breathe or whatever. And you say, well, what about this vaccine stuff? And now all the anti-vaxxers are on your case. You get them all riled up. You've got to be careful with vaccines. If you rush them for political purposes, you run the risk of what happened back in '85, getting a bunch of people sick with a bad vaccine. I'll take the vaccine when Fauci says it's safe. I'm not going to listen to any politician. But, you know, I think we should take it when it's safe. But, you know, you need to have the people who aren't influenced by politics at all make that determination.
You're saying in a new poll that 40% of Americans are not going to take it first time because they are worried about the safety factor. Holly, how about you?
So as it was mentioned, people of color are dying at high rates from COVID due to many factors like medical racism. So in my mind, white folks who are deliberately neglecting to wear a mask are in a way perpetuating racism because they're aiding in a spread of a virus that we know disproportionately infects and kills people of color. So my question is, would you say that that is true, and should more people be making that connection?
I think that's part of a general connection, which is definitely true. There's disregard for people of color. There's also disregard for people of different socioeconomic classes. That's part of it. You know, and if I was still working as a janitor, poor white trash would also be in that category. Sorry for the term, that's what they used to call it down south. But yeah, there's some racism there because a lot of the wealthy people you see, I mean, my origins are not from wealth. You know, I know hunger, okay? But a lot of the people who never knew need, they just don't get it. You know, what life is like for other people. They don't give a damn. And sometimes it's race-based, sometimes it's just general class bias. But yeah, there's a strong flavor of racism there.
Ruth?
Hello. I just had a question because, like, I know during your interview you referred to your colleagues as non-racist, but then, like, there's been more of a movement to be anti-racist. So I just wanted to know, and like this kind of segues into it, like, what are your thoughts on like affirmative action, like especially like in medical school, because like currently in California it is banned, and like I know you're from Texas where it was banned. So like, what are your thoughts on affirmative action, basically?
I think we need to have affirmative action. I think the best way to base it is on one's socioeconomic status. I think you will find that students of color come from more frequently from disadvantaged socioeconomic backgrounds than most white folks. There are a few white folks who didn't come up with money who could use a little help too. So in my personal preference is to look at someone's socioeconomic background. My African-American colleagues, well, they weren't, one was just Plaid African. He was, our neurosurgeon was from Nigeria, but three of our top surgeons when I was working, you know, were of African ancestry. Their kids probably, you know, don't need a heck of a lot of help to get into college. They're making big bucks. You know, they're living on ranches with horses and stuff like that, but they're not the average. They're not the average. But the best way, I think, is not to make it race sensitive, but socioeconomic stratum sensitive.
Very good. Ken Tran, and then Anthony Lucido.
Yeah, hi, doctor. So I know online it says that after you recover from COVID, there's like a certain amount of time where you're like technically immune. I just want to get your insights on that as a doctor and if that's true to an extent.
Good question. Again, we don't know the degree nor the duration of the immunity. It's just too early in the science yet. That's something we just have to follow. We don't know if the vaccine's going to work. We don't know. I mean, you know, you got to make a distinction also, and I don't know how much science y'all have studied. A coronavirus and a flu virus are different viruses. They have different ways and rates of infectivity. The cold virus is a coronavirus. They're awful easy to catch.
Anthony, and then Courtney Vasquez.
Hi, doctor. So in my previous community college I attended, I took a intercultural class, Chicanics and Latinx history. And one of the things we talked about is like the Mayo Clinic and how they needed to do more to connect with the Hispanic community. So I wanted to ask your thoughts on what should be added to doctors' education, like intercultural studies to connect more with their patients, and are there any other classes do you think that should be added as well?
I got to confess, I don't know what classes they have in medical school nowadays. It's been a long, long time. One thing I was impressed by when one of Professor Bob's old students is a friend of mine, Ramona, and she connected me. Now, refresh me with the question again. My brain's getting overloaded.
Do you think like cultural classes or any other classes? Yeah.
So the medical school where I saw all these tortures going on, the newsletter that I got from them, just Professor Bob and I were making contact, showed a multicultural group of faces of many color and white coats out in front of the medical school saying white coats for Black Lives Matter. So yeah, I do think there needs to be cultural awareness. I suspect that they're teaching it now. One reason I renewed my subscription to the New England Journal of Medicine recently, even though I retired and was going to let it go, is as Professor Bob and I were talking, they start putting a whole spate of articles in there about socioeconomic stuff related to racism and medical care related to racism and how all this affects the quality of care. One really interesting article by a Black physician, he's saying, here I am, top-notch urologist, super specialist, but because I'm Black and I'm big and tall and look like a football player, people don't think I'm a doctor. Can we have some consciousness raising here? Yeah, there needs to be consciousness raising. You need to know who you're taking care of. I mean, I did my own form of study. You know, most people haven't, but you need, that's one reason I did all this multicultural stuff at the old San Jose Medical Center. I wanted the medical center to be aware of who they were taking care of. Different cultures have different requirements. If you have, you know, Muslim patients, for instance, you don't go crossing your legs and showing them the sole of your foot. That's disrespectful. You know, Asian patients, you don't go patting them on the head. You're messing with their crown chakra. Just little things like that. What food people would eat. We were terribly culturally insensitive. I created the Asian task force to help the Asians because there were so many of them, and then multicultural task force to help look at all the different kind of players we had there, how they were different and what it would take to optimize their road to health. So yeah, the answer is yes.
Now, Manny, you said you had a follow-up question. We're about out of time. Go for it.
Yes. So you said that we don't understand the genetic correlates, and that, I mean, there are a lot of people who have extreme risk factors who are very old, who have lived, and then there are very young people who were healthy who have died. What do we need to understand how this disease is affecting people differently, and what are we going to be able to do about it if we do come to understand the genetic correlates?
Good question. Good question. It's going to take more and more research because you're going to need to segment the population. This is going to be the power of big data, okay? You're going to accumulate a lot of data on these patients, and you're going to start doing genetic studies and find out what correlates. I mean, you know there's some simple things that correlate: asthma, heart disease, diabetes, etc. But what other factors? For instance, there's some evidence that the way that the molecule attachment occurs between the COVID virus and the ACE receptor is different in different people. And we found this is true with HIV patients. There's a very small percentage where the HIV virus can't even attack the cell because it's different. And so if nature took its course, there'd still be people that survived HIV. So these are things we need to study, like the attachment. Some people, it's easy for the virus to attach. Some people, it's not that easy for the virus to attach. Is that effect just in the cell? Is it in other factors, which might be in the blood, you know? And then you're gonna have to look at the genome of each of these individual patients and compare it to find out what the risks are. So science is on the track of this, but there's a lot we still have yet to discover. And then you might be able to tailor therapies, and you could certainly tailor preventive therapy approaches.
Michael, you got 2 more minutes. Last question.
So awesome. So this is more of a, my friend has not left her house for the past 7 months, and she's been taking it extremely seriously. She sometimes goes in her backyard, and she'll sometimes go for a drive around the city, but that's most likely it. This has now caused her mental health to become more at stake because she does not, being that she doesn't leave her house and she doesn't really like open her windows or anything, she doesn't really get any sunlight. Do you feel that she's taking the correct measures, or do you feel that she is taking it to an extreme where at this point, it's like, what do you think is more important for her to like maybe go outside and go to like a park or something, or to continue to let her mental health get to where it's going because she hasn't left for this much time? She even like Instacarts, she doesn't get groceries. I, in fact, got groceries for her at some point because she wouldn't go to Trader Joe's. But so yeah, I just want to know what your take is on that.
Well, I think she's overdoing it. You're not gonna, your vitamin D is going to go down if you don't get any sunlight. Low vitamin D level is a risk factor for getting COVID, independent of other things. Of course, if you're not around anyone, you're not going to get COVID. But, you know, a lot of people's mental health is suffering, especially these old people that never get to see their family that are locked up in facilities. So yeah, going to a park is a good idea. If you're in a park and there's not a lot of people around.
She lives in her home with her family.
Well, the family's got to get out somehow, but no, she's going to have to get out of the house. There is a balance point here. I'm not going to not be unafraid of COVID, as some guy suggested, but I'm going to live with a healthy fear of it. But I'm not going to I'm not going to avoid seeing my grandkids. That's a little risk. I mean, my kids are careful with the grandkids. Well, I'm going to take that risk. How much are you willing to give up? I'm not willing to give up seeing my grandkids.
Good to know. I will let her know.
You mentioned the homeless, Bob. That was the note.
Yeah, I was going to say that real quick. Anything you want to say about the homeless? You have about 1 minute.
Thank God that they're in open air most of the time. It's the only thing that's saving them. They cluster together, and the infection rate in the homeless isn't near as high as a lot of people have anticipated. But the whole key to that, and this is speaking as someone who helped finance the first program in Santa Clara County to house the homeless. When I was with Health Trust, you got to get them housed. Then you can case manage them. You got to get them off the street. They need housing. That is first and foremost what you got to do for the homeless. When we got them housed through Project Connect, then the case managers could go in and they could say, would you like some help with the mental health, substance abuse, your diabetes, your foot ulcers? You can say no and you can continue to drink, but most people will take you up on that because they got enough common sense to know it's in their self-interest. So we need to do something like that.
Shannon, thank you for putting that in the chat, because I was wondering if anybody was going to ask that question as well. Doctor, we've run out of time, but I tell you what, we're going to adopt you. I'm just going to tell you straight up. Over the next few weeks, if there's anything else about COVID or anything else about we need to talk about in terms of medical issues, can we call you back?
Oh, you can, Bob. I love teaching, and that's one thing I've missed since I retired from medicine. I really enjoyed the teaching, and I enjoyed talking with all the students, hearing the questions. I always learn from stuff like this. And when you're old, if your brain doesn't keep learning, it's going to shrivel up. So yeah, you can count on me to come back.
Thank you. And guys, let's see a visual shake here to thank the doctor.
Yeah, thank you so much, doctor. It means the world.
See, you guys are welcome.
It's always
been my pleasure.
Doctor. I'm sorry, doctor, what were you saying?
I just said it's been my pleasure.
And I was just saying it's always reassuring to hear from a doctor you trust.
Thank you, Bob.
All right, guys, stay safe. Look at my website for your next assignment. We're probably going to have another guest speaker on Thursday. I'll make the announcement on my website, profbob.sjsu.com. See you next time.
Bye, Professor. Thank you so much.
Bob, I have some news for you.
Okay.
I was able to connect with Dr. Sira Madad, who is the